All right, welcome everybody to the sixth and final session of our Research in Schools full day webinar that Research Services has conducted today. We are joined for this final session by Minnie King, Dr. Nina Lansbury, Olivia Milsom and Dan Tonon. They'll probably do some introductions themselves, and they're here to talk to us about health and hygiene education in remote communities, specifically the Green Flow project. So I'd like to give them all a warm welcome, hand over to them, and they will do an acknowledgement of country as well. So thank you for joining us, and it's all yours.
Thanks, Amanda. My name's Minnie King. I'm speaking on Anglith country, and we'd like to acknowledge the Anglith traditional owners, past, present, and emerging, and for all the other traditional owner groups in the Western Cape York Peninsula, our acknowledgements to them, and for anyone else speaking on this today's presentation around this great state of Queensland for the traditional owners past, present, and emerging. So thank you very much for having us, and with it. Next slide. So this is setting the scene globally. So in reference to the World Health Organization, there are specific there's specific information on menstrual hygiene. In fact, menstrual hygiene is moving and adapting as we go, and in fact we now refer to it as menstrual health, but back in the day when we were looking at the World Health Organization, it's mentioned there in terms of teachers not having the required information and skill sets and training in relation to menstrual health. In particular, up here in the Western Cape, given that it's a remote school, that there's a large number of the cohort are traditional owner and or First Nations students. We saw this as an opportunity in terms of having something quite specific to the region, but also as far as First Nations students go, that information that was delivered in a safe space and culturally appropriate manner. So in terms of the World Health Organization, I suppose we've started at the highest level. And then if we go to the next slide. And with the program that we've implemented here, that commenced in 2017 with our first visit to the Western Cape in 2018, we've actually landed on something that is designed for a remote community with predominantly Indigenous population, for remote schools. And this guide that we have developed is all about menstruators. In terms of our terminology, that has evolved over the years as well, over the last 7.5 to 8 years. So people who menstruate or menstruators, so we have adjusted that to be more inclusive. And we're looking at the different issues that have been identified locally. So the main one being pain management, and then also hygiene strategies in terms of the infrastructure in school toilet bins. Then we've got culturally appropriate, as we were speaking about before, and support for girls in schools and also boys. So our program has extended to include boys, and that was essentially demand driven. And so we've been responsive to that. And then also privacy for people who menstruate. We have a population that is quite mobile, and people can live in different houses in different areas, from as far south as Cairns or Townsville to the Torres Strait in the north, or perhaps Arakoon south, 2 hours south of us. So these communities and people within them that are on country do live in different houses and places, and access to facilities is not consistent across the board. We've also considered minority groups, Indigenous or First Nation students being a minority group within their own right. This has provided us with an opportunity to look at trans or gender fluid students. They require, special consideration and support, as well as other students that may have special needs or a disability, looking at teaching guides that address those specifically, especially in a remote and or Indigenous context.
So thanks, Minnie. So my name's Nina Lansbury. I'm from the University of Queensland. And I think what you're seeing from your screens of us in the room is showing this collaboration. We've got the school principal here, Dan. We've got myself and my honours student, Olivia, here, and then Minnie, who's a local businesswoman, a local community member, who initiated this work by inviting this research to come up to community. So this issue, as Minnie described, was identified in my research and others. But around 2017, Minnie got in touch and she said, let's explore this on country in a remote community, and let's do this in a way that is culturally appropriate, that is locally accepted. And so what you can see on screen is a photo of Minnie in one of the earlier sessions with the students in the pack, where we've just launched what the story we're going to tell you today with this beautiful teaching guide that we're sitting with, and we'll give you the web link in a moment. But over these 2017 to 2024, we have developed a teaching guide that has gathered and reflected both the students' concerns about when they have their periods, as well as their own solutions and wishes for how to manage it best. And then in between those two parts is how do they best pick up this information from the different areas in their life, but particularly here in school with the curriculum, when are periods and more broadly puberty and sexual and reproductive health taught, and how is it taught in a way that lands. And also on screen you can see what we call the touch table, and we find this is one of the many activities we run that's very interactive, where the students can actually look at these products. Some of them are quite new to them, even to many of us who are older. There's now reusable products like pants, menstrual cups, and reusable pads, and you can see the photos on screen, as well as disposable products. So having students engage, creating a space where there is no shame. So there's often stigma and concern when you raise the topic of period. And I know myself as an almost 50-year-old, it's very awkward the first time you start speaking more broadly about periods. But that's part of the role of being in public health, is to learn how to have awkward conversations about something that is biology. And obviously here we have a cultural dimension too, but Minnie has guided us with contributions from across the community and traditional owners in how to walk through that space. So the next slide, just a little bit of context of where are we. You can see on screen that there's Weipa, and we're just north of a community called Napranum and south of a community called Mapoon. And so we have delivered this information program into both campuses of Western Cape College, which is where we're sitting today in the Weipa campus, but also to the local Catholic school, St. Joseph's. And you know, you can see a beautiful picture of country as you fly in here. But it is very remote, and in the small communities, there's only one shop. So that means that the products are very limited. People live in different settings. So there are some young people who are living between multiple homes from their family. So there's not always products available. The traditional teacher about in cultural ways are not always living in the same community. So those cultural ways of learning about puberty and periods is not necessarily there. So it means that much more emphasis and responsibility is put onto the formal education setting, which is the school. But then if you know, the curriculum is pretty minimal and pretty late in Queensland and actually in other states for teaching about periods and the wider context of reproductive health, such as contraception. So these students are hungry for knowledge. We have found in our discussions there can be a lot of misunderstandings, such as the contraceptive rod that some young women have inserted. They don't always know what's the limit of protection provided there, because there are some misconceptions that the rod provides protection from sexually transmitted infections, which it doesn't. It's only a contraceptive. So having these discussions that are open means that we take away the shame and we create a space of discussion. And of course, that beautiful thing, myself as an adult educator, is when there's co-learning, when the students are listening to each other, that's when they really identify solutions that they'd like. Just one more slide for me. Oh no, 2 more slides, and I'll get you to press it one more time. Thanks. So you can look at a lot of publications that Minnie and myself and our other colleagues have published. So we have a lot of material out there where we've documented the challenges that students have told us, but we've also documented their solutions. And you can see there, we even had the students self-voting. What are the trickiest challenges for them, but also what are their solutions. And the second year into this program, we'd listened very closely to the girls, and they had said, please, please talk to the boys. They tease us. They make our life difficult because we think they don't understand enough about what we go through. And we very tentatively opened up to having boys sessions. And this year, for the first time, we gave the completely identical information to boys and girls, still in gender segregated sessions. And kudos to Dan and his teaching team here. Those young men in the room showed such maturity. Obviously, there was awkwardness, there was giggling, there was a little bit of shyness and lack of eye contact initially. But by the time we were through our 40-minute class, we were having really good dialogues. And then we've even heard some beautiful follow-up comments, such as the school nurse letting us know that there were some young men who went and asked whether she had any pads or tampons that they could take home and ease the financial burden for their mum and their sister. And then also the young men talking about ways of engaging with their girlfriends and thinking about their role going into the future. And then another slide is just the showing the if you are to click it, thanks, Dan. Yeah, it's just our, when we commenced in the school, so Minnie and I commenced this work in 2017, but we actually arrived in the school in 2018, just for girls, just one campus here in Weipa. And as of this year, we're in 2 different schools, obviously the Catholic school, as I mentioned, but also Western Cape College, which has 2 campuses. We're teaching all genders, and much to our delight, we've been given the opportunity. It says girls grades 3 to 5, but it's not. It's grades 3 to 12. That's my error on screen. So young students are so open to this. They're a little bit shy about it, but being able to talk to them really early before, for many of them, they have menarche or the onset of menstruation. And you can also see we've been in 3 different locations. All right, so handing over to Olivia to talk about what we just launched about 1 hour ago.
Yeah, so we're at Western Cape College at the Weipa campus, where we've just launched our teaching guide, Mind Your Body. So you can see the link on slide, which takes you to our webpage, where you can access this free resource, which has been backed up, like Nina and Minnie have said, of 8 years of research and trialling here up in the Western Cape. It provides a solution to both the students and the teachers. The students have told us that they want to learn more, and the boys need to know as well, but also to the teachers who can be uncomfortable and awkward and not sure how quite to teach this content to their students. It has been taught to year 3 to 12, and the guide is developed to be taught across all those years for all those students. And we're currently seeking partnership and funding opportunities. We really would love to have this rolled out across more schools and get an evaluation going, as well as some funding support to provide these menstrual health kits valued at $260, which include copies of our guide, posters, our touch table products, and some other little things as well. Next slide, Dan. So some key messages of what we've learned so far. We have learned that a need really exists, especially around menstrual health, puberty, and consent and sexual health, and that this conversation needs to be had earlier around year 3. Some students, a small group, but some do start their periods in year 4, so we really need to be targeting these students just before they start their period. We've also learned that boys, they're so mature and they can be engaged in the exact same materials as girls, and that students in remote settings face a unique range of opportunities and challenges that contribute to their growing up lifestyle, their puberty and their menstrual health that aren't necessarily faced in urban students. So the need for remote students' contribution to a teaching guide that addresses their specific challenges and needs was really important. And like I said before, mature conversations both between the boys and the girls. Instead of going to social media, they're able to access this guide, and we can see from when we've engaged with them over 7 years that although there's a little awkwardness at the start, they really have shown that they can engage in mature conversations, join in, and we've been able to see that they're able to support each other as peers as well. And parental support, our attendance has been really high with less than 1% of students opting out through our permission process too.
Thanks. My name's Dan Tonon. I'm the college principal here at Western Cape College. It's important I just give a little bit contextual information around the college. So we've got 1,056 students across K to 12, across 4 unique campuses, 2 primary, 1 in Marpoon and 1 in Weipa here itself. I've got a secondary school, and I also have the only state-run Indigenous-only boarding facility. That brings in a catchment of kids across 27 communities across Cape York and the Torres Strait. So we have a very unique demographic of students. And to me, this is a really, really great example of a place-based need and a place-based approach that meets the needs of our young people and the needs of our community. So I guess the other part to this that I've loved is that it's action researched. It's come in, engage, review, reflect, refine, and then come back and go again. And it's been built over time in partnership. So it's a really good evidence of what can be achieved in a place-based approach. Some of the things that I guess I've noted in this space is that we all know our curriculum is crowded, and that has often led to things like menstrual health and just well-being often being just built in as best it can without being given the attention it deserves. And unfortunately, I think from my perspective, I think our knowledge of our young people in terms of their health has either stayed the same or has regressed over time. And potentially that's the impact of social media and the lack of accurate information being out there. But our kids, it still shocks me the limited amount of knowledge our young people have. So this opportunity to me was about bringing outsiders in, because we know that often bringing outsiders or not that different people into the classroom, kids' ears will prick up and they'll engage. But I do acknowledge our kids, their engagement was super high. The presentations and the way in which they engaged and the way in which we were able to build conversations that potentially went a lot further than we'd planned because of the level of maturity that they showed, and the fact that we just broke down a lot of those barriers and that awkwardness really early on and then built from that. The bit that I've also appreciated as a non-Indigenous principal is navigating the space of cultural protocols in this space and the ability of this program to be able to meet them and be able to ensure that that consultation has occurred and has happened to enable us to be able to just get on with supporting our young people to know and understand about this really important topic. So to me, in summary, I think it's been an extremely valuable piece of work that has now got an artifact that will enable us to build this level of sustainability into it, so that when these guys move on to different roles and different pieces of work, we'll be able to continue to build this into our program here at the college and be able to build on the knowledge and I guess bring in additional expertise as required. So thank you to you guys, and we really appreciate the work you've done for us and with us.
Thank you, Dan.
So there's our contact details, but also the link to the guide, and hopefully you'll receive this pack or the 2-pager, but there's also some publications that Minnie and I and other collaborators have put out. So over to you in case you'd like to ask any questions.
Thank you so much, everybody. What a great presentation. So we've got a couple of great comments in there, just confirming what great work it is and what important work it is. Does anybody have any questions to ask the team? No, I thought someone was typing something, but no. I was wondering, are you thinking about, expanding this beyond your area? Having collaboration with other school areas and doing, similar things?
Yeah, it's Minnie here. I think Look, the focus has definitely been on Western Cape, having family here, living here, working here. And for Dan himself, we've put down our roots. So it was getting to this point. And I think, anything is possible. We certainly generated throughout the years some interest, particularly not so much from within the state, but from Western Australia, for example, from the Commissioner for Children in South Australia. So there's been a lot of other states and territories outside of Queensland, and that's obviously because of the work that we've done and articles that we've published in relation to this research as well. So it certainly piqued their interest. Look, I think ideally, and our goal would be that for this guide for it to be across the entire state, because these are the same issues that children or students are facing, in urban schools. The shame and the stigma being the single biggest thing that when we went into this project and this research, that we thought that would be the inhibitor, and we wouldn't possibly get as far as we've come. But as Dan said, we've broken down those barriers very early on, and we've made this about the science and the biology. And the students have appreciated that honesty and not sugarcoating it as something else. So we've been upfront from the get-go, and the way the students have embraced that has been phenomenal. So this guide in its current form can go around the country if it likes. It's for uptake for anywhere, and it can be adapted as well. So Nina, did you want to add anything?
Yeah, look, and we're hoping, like, this today is the launch of the guide, and the date that Department of Education. Yeah, well, that's why the date happened, because you put it in the calendar and we said let's focus on this.
Great.
But also, we're really honoured to have this opportunity to talk to Education Queensland as a statewide presentation, because this is the logical place for uptake. And as Minnie said, we've beyond schools, we've had these questions from Aboriginal health organisations, community-controlled health organisations, as well as the Commissioner for Young People in South Australia. So there's a lot of interest. What we would love to do, and Olivia mentioned it, is we'd love to have a level of evaluation. So our offer to those online is, if you're going to be using it, please do consider the baseline and post surveys that are in there, because we'd love to hear from you. We also want to, as Dan said, keep iterating, so this can be the best guide, but more importantly, the most useful guide possible. So we'd love feedback in any form, but we would like to have some sort of evaluation that we'll conduct.
Fantastic. So, Kerry, I think that probably answers your question as well, which was similar to mine. We did have a question from Linda about how the project was funded.
Yes. There were some times of boom and times of bust. Initially, it was funded by some internal University of Queensland funding. There's also been some Health Translation Queensland funding. Minnie, do you want to talk about other sources?
Yeah, and I think besides the University of Queensland, I'm fortunate to run a business and with my husband up here, and look, because this is something that was culturally, for me, it was not something that I experienced. There was no stigma from my mother and my grandmother. It was taught, and I understand, from families, for example, if you come from a predominantly male household, that you're not going to have that conversation and a cultural aspect, because there might be other priorities, or if there's in terms of funding and money and availability in the household. So my situation was that, having that cultural background and exposure initially, and knowing that this was spoken about, this was a part of our traditional learning, but also having a business that could come in and support this project that I was so passionate about. So yeah, we've basically funded this with the University of Queensland in partnership with the company that we have up here in Western Cape, but we do a lot for the community. So it's not, and this is one of the things that we do. So we're very, we're out, and Dan, hopefully you agree that, absolutely, our company is out there and doing things. So
yeah.
I think Scott was mentioning
had to,
Queensland Health as well, whether that's something that they could, work collaboratively with you on.
Yeah, so there may be some Queensland Health attendees today because we've been in dialogue with them, and there's the Queensland Women and Girls Health Strategy was launched earlier this year. It's a really fantastic looking document, and menstrual health is mentioned, and there is a puberty program that is going ahead with Queensland Health. So watch this space. We're aware of each other's work, and we just take the approach that this information really needs to be in the hands of our young people, and getting it there in the best quality structure is going to benefit everyone.
Fantastic. And Dan, I think a question for you just in relation to within the school when we have high turnover, well, everywhere, but certainly perhaps more so in your area, how are you going to cater for this to ensure that, the new teachers coming in are going to be up to date with, this program and how you're going to run it in school?
Yeah, sure. So, and I guess I'll acknowledge Helga Scott, who asked the question, and Helga's great work in this space across many of our other discrete communities. I guess from my perspective is it first of all needs to be valued by the principal. And I guess that's something that I guess modeled and hopefully come in and I guess especially in those boys session, model to them about how to handle it in a mature way and ask the right questions. So the first and foremost importance in that space is the principal valuing this as part of that global sort of support of young people's development. Obviously, I'm lucky that Minnie's here and I don't think she's going anywhere soon. So I'm able to then, I have a resource and a support person within my community that I can lean on to do that space. And then obviously I don't have the turnover that other communities to my south and north have, but I guess what we're keen to do is to develop an implementation plan that brings the expertise out, that identifies those key teachers within our campus that will keep driving this across our primary and secondary. So a couple of things in that response, but I guess it starts with the school and the leadership valuing this as something that is part of our core business.
Like everything, right? Yeah.
Yes, with everything else.
Yeah. So then just one other question. Look, maybe we've answered your question a little bit, Maria, but she was just questioning whether you've had, any mixed messaging or any negative messaging, such as has been in the media in relation to people having concerns about talking about these sorts of things in public.
Yeah, I'll answer this and then you guys can. So I guess a couple of things. Our kids often will take in a lot more of the information and be a lot more engaged with external speakers. I live on the edge in that space, in the sense that I am the only school, and the school down the road is a long way down the road. So I have the luxury of being able to deliver this stuff, and I guess push some boundaries in that space, because to me, we have to make sure our young people are getting that accurate information. It comes back to, I guess, that clear communication, though, through our letters out, taking any concerns on board, addressing them with, I guess, some honest dialogue, and being willing to just set it up with the kids the right way. I think that's part of the biggest challenge of this. If it's not set up in that first 5 minutes really well, so the kids understand why, not what they're talking about, but why we're talking about it. I think you can overcome a lot of those potential concerns really early. So, yeah, that's a couple of the things that I've sort of thought about over the time.
Yeah, I agree. And as Dan said, like this is, Dan's been here for the entire time in the school, and for the last few years as principal. So Dan has seen the evolution of this project and this research, and it is absolutely school first. And then I suppose what I represent is community first too. So it is a partnership of the community and the school coming together, because if it's driven, you know, it's not for everything, but in this situation where the community, you know, I originally consulted with traditional owners who are family members and spoke to them, some of which were back in the day, they were registered nurses, so they were in that health area. So that all the background research and everything up front, so that when we came and spoke to the school, we spoke to Dan in terms of the cell, in terms of the uptake, all of that. Dan talks about the effort for the students and kids. There was a lot of effort done in the background before we even approached the school, so that when we did, we had absolutely everything covered off to allay any concerns that they had. It was culturally respectful. We understood each other in terms of creating this safe space, which is a key theme all throughout our work. And so that effort up front, and then also, as Dan said, and as we've said, is that going into these sessions with the students and being up front basically from the get-go. The students appreciate honesty, and to be honest, they would see through it if we tried to mask it as something else. So the whole program from start to finish, including today's launch, has been an absolutely profound success for anything in this space to tackle menstruation, menstrual health for Indigenous people. And then you layer it and say, well, remote communities, is just a phenomenal achievement. But we couldn't have done it without the community. And I just think it's just a tremendous example of what we can do in this space with education and health coming together in this remote setting, and particularly with Indigenous kids who are still very much culturally connected. So thanks very much to Dan, if we haven't already said, because without the school support, we wouldn't be here today.
Thank you so much. I don't actually think we could have asked for a more inspirational finish to our webinar today. So I want to thank you, Nina, Olivia, Minnie and Dan, for your wonderful presentation. I want to thank all of the presenters today. For those of you attending, if you just attended this session, if you attended a couple, if you attended all 6, we are so pleased that you joined us. We hope that you will continue to keep an eye out for webinars and face-to-face forums that Research Services provides, because our whole goal is to encourage people to get out there, research in schools, create materials, create artefacts that are going to be able to be used in schools to improve student outcomes. And we just want to, keep the ball rolling with all this wonderful work that researchers are already doing. So thank you everybody for joining us. Enjoy the rest of your afternoon, and if you have any issues with any of the materials that have been sent out, let us know. You should all receive them via email without any issues at all, but Charlotte and I are happy to help if you have had any issues with that. So thanks everybody, and have a great afternoon.
Thank you.
Thank you.
Thank you.
Thank
See you later.
you.
Bye.